Hello everyone, I'm Hattie Davis and I chair Princess Alexandra's board. This is our update from our board meeting, which took place on Thursday last week, and we had a lovely number of colleagues coming and joining the meeting. It's great to have visitors at our meeting. Please everyone, feel free to come and attend if you'd like to know what we do at our board meetings. This update covers some of the highlights from the meeting. The full set of papers are on our website as always. As is usually the case, we started with reports both from Lance and from myself. I'm sure you all know by now that Lance is leaving Princess Alexandra after 7 years for a new role as Chief Executive at Frimley Healthcare. We're all delighted that he's got this new job. A big thank you to everyone involved in the recruitment of the new Chief Executive. We had 24 applicants and have a really strong shortlist of 4 applicants. The interviews take place on the 18th of June, and we've set up stakeholder sessions for as many people as possible to meet the candidates and feed in their views to the final panel. The next items that we talked about was the Risk Corporate Register. We discussed covering a wide range of topics and the actions that are in hand to mitigate them, with a clear focus on patient safety and the quality and, of course, our estates. We recognise that we have a critical backlog of maintenance on our estates, and we're building plans at the moment to resolve that backlog. The next item that we discussed was nursing and midwifery and care staffing levels, which I know is important to everyone, whether a staff member, a colleague or a patient. I'm delighted to be able to report that we've been able to successfully recruit a number of new posts, enabling much more stable staff levels. Staff no longer being redeployed into areas that they don't normally work on, and less reliance on temporary staff. This in turn is already demonstrating a big improvement on key indicators like a reduction in falls by our patients. We then talked about learning from deaths, which is a slightly odd topic, but a really important topic for the board to consider. Each month we receive a report to ensure that we have learnt the lessons as an organisation and improve our services from each death of our patients. Over the last few years, we've been able to action this learning, and I'm really proud to be able to report that we now have fewer deaths than national comparators would predict we have. We're one of the best in our region. As always, improvement doesn't come about from a single change. It is as a result of the hard work of thousands of colleagues. A massive thank you to each and every one of you for what you've done in this area of our work. Alex Health is, as you probably all know, the name of our new electronic health record, and it will help us to manage the information we keep on each of our patients and help us to ensure more effective and efficient practices. We discussed the very tight timescale that we face and the additional training and support for all our colleagues in facing the changes that this will involve in their everyday working practices. We are really proud of the way our PAHT people have supported this work and know it will be of benefit both to our patients and our colleagues in creating safer working practices. As you know from the media, the NHS is in the middle of a really tough budget setting round. In our case, our budget is agreed across the whole of the NHS in Hertfordshire and West Essex. We've agreed our own internal budgets for each of our divisions, enabling our clinical and management colleagues to get on with running their services. We haven't yet managed to finalise the bottom line, although this is due to be agreed this week. We're seeking support to increase work in our areas like hip and knee operations, reducing the waiting time for all our patients, which will be really important for everybody. If you're interested in the information that is presented at board meetings, the papers are always on our websites the week before the board meeting, and you are very, very welcome to come to the meeting itself, which is held in the boardroom at KO Park. The next meeting for us is our AGM on the 12th of September, and our public board meeting is at 9:30 on the 6th of October. Please do come. We'd love to see you there. Thank you.